Hi, everyone. I'm Dr. Diana Bitner. We're going to have a fun conversation tonight, excuse me, about what are we going to call this? Sugar, sugar and spice. Sorry, I have a tickle in my throat. Around the connection between metabolic health and sexual health. Hey, Celia, we've been laughing about this before we got on. This is
Yeah, no,
fun.
we're laughing so hard. Now we got some tickles. I'm Dr. Celia Egan. I'm the internal medicine doctor and obesity medicine doctor at True Women's Health. And nothing gets us more excited when we can combine our two worlds together.
It is a lot of fun. So we're going to have a classy but casual conversation. If any of you want to chime in with comments or questions, please do. We know that people are pretty shy about being public, being at a conversation about sexual health, but hey, we all learn from each other, so we hope that you'll chime in so we're not just talking to ourselves or think we're talking to ourselves tonight.
Yeah, we always
So,
have questions.
what's that?
We always love the questions.
We do. It keeps it real. And sometimes it gets pretty fun. But, we always start out with like, why are we even here? So I'm here as a gynecologist because, for years I knew about blood sugar and diabetes, thinking about women who are pregnant, having gestational diabetes, and thinking about maybe somebody who had type 1 diabetes who was getting pregnant and the challenges of that. So, of course, I knew it as this somewhat abstract medical condition, that I didn't think about it with other applications, and started to learn about, how diabetes really explains a lot of symptoms. So happy to have Dr. Egan here. Of course, it's her specialty as an internal medicine doctor. So we've learned a lot.
Yeah. And, in the first part of my career, I worked in the hospital and I saw kind of the worst case scenario, sort of the end stages of diabetes when people were on dialysis or even losing limbs and eyeballs because of having really high blood sugars over a long period of time. And that really spurred me to sort of change my career path and get involved on the kind of back end and get involved with preventative health. I think one of my favorite aspects of our clinic is we do a great job of looking as deep as possible to ensure that if a woman has any issues with sugar, that we're there to kind of diagnose that and support them.
Right. And years ago, really understanding why women, for example, would have hot flashes with menopause, even on estrogen, turns out high blood sugars and low blood sugars can be a cause for hot flashes. But never did I think it would affect sexual health. And so as I learned more and more about sexual health, then it became evident that high blood sugars, even in the pre-diabetes range or the insulin resistant range, can cause problems. And as we know, menopause is a pre-diabetic or an insulin resistant state. So it's a big deal.
Yeah, totally. And I think that sometimes, even more so in men's health, sexual side effects can really be this first sign that a patient is struggling with, issues with their blood sugar. And one of my favorite parts of working at True is that we kind of have a style for talking about sexual health.
We do. And so, thinking about this, of course, if a man has high blood sugars, he might have a more obvious issue of erectile dysfunction, of ED, and can't have an erection. With a woman, it might be, I didn't get aroused because maybe I'm not in the mood, or there's something wrong with me and I'm just going to kind of suffer through. But it turns out that difficulty in having an orgasm, difficulty in with arousal, can be a sign of high sugars or diabetes. So back in the day, as I was starting to learn how to talk about sex, I invented the sex deck. I would be in these lectures at sexual health conferences and hear my esteemed colleagues talk about low sexual desire. And I thought, how can I remember all this stuff? So I invented a card game called the sex deck. And there's 27 reasons for low sexual desire. And each one of these cards describe each one of that. These are divided into 3 different areas: physical conditions, interpersonal conditions, and psychological reasons for low sexual desire. And in speaking of the couple that we just mentioned, under the physical category, there's 2 main ones we see as affected by blood sugars, including fatigue, certainly can happen with high or low blood sugars, and difficulty achieving orgasm.
Hey, Dr. Bitner, I'm just going to pause for a second. Could you explain a little bit of how you would coach a patient on how to use the sex deck?
Awesome. Thank you.
I think that's so great.
Thank you. So what we do in the office, if someone comes in and they say, I have, concerns about my libido, my sexual health, my intimate relationship with my partner, then one of our nurses will say, hey, grab the sex deck when you go in. And so what we'll do is go through the deck and see which cards might apply to her. not maybe in a way that she's thought about it before, but to actually go through the deck and say, does this apply to you at all? So, for example, incontinence, do you lose urine or lose stool, especially, of course, when being intimate? Yes or no? So we put it in a pile of, let's say it's not an issue. Is fatigue an issue? Yes. Is difficulty achieving an orgasm? Like, if you can't have fun being intimate, then a lot of women are like, why should I even do that? Low estrogen. Oh, yeah, I'm in menopause. Low testosterone. I'm not sure, but probably. So again, we go through the deck and we make piles. And then we use the pile of things that apply to them to talk about how it might relate to their sexual health. It's been really helpful to make that discussion more efficient in the office. It makes it more objective, right? So it's not like a me problem or a his problem or a partner problem. It makes it more objective. Like, wow, there are really reasons for this. And then our patients will take it home. Oh, I'm sorry.
No, I was going to say, I think it just provides such this judgment-free way of allowing even a patient or a woman to sort of think about some of the issues that she may be struggling with, and or to be able to bring it home to their partners and do it together, right? And have different times where they're sort of, and again, a judgment-free way talking about some of these issues. Because the worst case scenario that we hear sometimes is that people are struggling kind of silently with sexual health issues, and they don't know how to, kind of come together with their partner and sort of talk about it.
Right. It makes me so sad, seriously, when I hear about couples who are not even like holding hands anymore, or, sitting close to each other because she thinks, what if I hold his hand? He's going to think I want sex, but I can't because it hurts. And then he's going to be mad at me. And he's like, I can't even hold her hand anymore because she thinks I'm going to want sex and it's going to start a fight. So it just becomes this thing where, there becomes a separation.
Yeah.
And
totally.
people aren't talking about it. So it's helped so many relationships. And every card in here applies to a guy except low estrogen. So, it definitely can be helpful for both sexes.
Yeah. So in thinking about, there are sort of certain cards that we think about that kind of pop into your mind, maybe issues with blood sugar. Do you have some of those cards in mind?
Yeah. So it would be, even depression, anxiety, blood sugars can relate to mood disorders. And when people aren't feeling well or just feeling off, or that's definitely one. We could talk about that. I lost it here. In terms of difficulty with orgasm or arousal, it's hard if there's not great blood flow down to the clitoris. We're going to talk about that. Then that can be an issue.
Yeah. So let's pause on that one for a second, because I think it's really important to review this. So one of the biggest issues with diabetes itself is that having those high blood sugars basically causes flow problems in the important blood vessels. Now, internal medicine doctors, we harp on the big boy blood vessels that you hear about all the time, right? Our coronary arteries, which is the blood flow supply to our heart. Those blockages can cause heart attacks and heart failure. We think about our cerebral vasculature, which is the blood supply to the brain. Blockages in those areas can cause strokes. Then we think about blood supply to some of the important organs that are almost those teeny tiny blood vessels, like our kidneys and eyeballs. But let's pop up the pictures of some of our sexual organs, because I think that this is really important to think about. So,
and how they're so similar.
My gosh, I know. So fun, right? So side to side, one is a picture on the left of a clitoris and on the right is a penis. The sort of spongy area are veins, which get engorged for a penis to cause an erection. And correct me if I'm wrong, but also get engorged to cause stimulation with the clitoris.
And she grows as well and has an erection of her own. It's just, people don't think about it this way.
Not maybe quite as maybe potent, I would say, as a growth, but still there and very much important for sexual pleasure and function. And as at the top of both these areas, you can see blood vessels. So you can imagine that if there's blockages that are preventing the blood flow to these organs, that it would be really hard to maintain an erection and or receive, appropriate pleasure if there's blood flow problems. And there was really interestingly some studies that looked at men who had, and I'll pause for a second just to just to call a spade, a lot of the sexual health studies have been done in men because of erectile dysfunction. So that's a lot of what we're basing this off of. But, in looking at studies with erectile dysfunction, about 50% of those men went on to have undiagnosed blood sugar problems. So, sometimes issues with either erectile dysfunction or just problems with a woman having, proper arousal and inability to orgasm may be an issue with your blood sugar.
Right. In a very simplistic way, I think about blood sugar making the blood vessel lining sticky. And so, especially if someone has high cholesterol, those blood vessels get sticky and the cholesterol sticks. Or, if one of them is out of balance. But anyways, the vessels are sticky. And so those little vessels get clogged. And again, to have an erection, the blood has to come in, and in those spongy areas, there's valves. So the blood then can't get back out. And having said that, as it gets engorged, the nerves get stimulated and all the good things happen. So yeah, blood sugar is so important. And again, having this anatomy right here, I think really drives it home.
Yeah, I think it's really powerful. So, and then when we're thinking about some of the other cards, so, we popped up the word fatigue, I think, as one that can
Correct.
be really important. And a lot of that probably is, when we're thinking about why we may or may not have blood sugar problems, one of the main organs that involved is our liver. So if we were to eat a carbohydrate or any really food, the next place from our small intestine that once those sugars get broken down into our small intestines that it goes is our liver. And our liver basically sorts and process all that sugar. And it's really deciding how much, of that sugar that I've eaten do I spit back out into the blood. And we believe that the changes to our liver may be the beginning of having what we call insulin resistance, where basically our liver starts spitting out too much sugar than what our body is asking for.
And again, in a simplistic way, I just think about how, the blood sugar raises with food that it didn't raise with 10 years ago. So women will say, well, I still want macaroni and cheese. Like, well, when you were 15, you got away with macaroni and cheese. Your blood sugar didn't go up.
Yeah.
But now it's going to pop with macaroni and cheese.
And and we actually have a great picture looking at some of the different types of ways that blood sugar is an issue, because we can even review some of the definitions of having blood sugar. But, when we say of getting away with, like, what are we sort of getting into the nitty gritty about? Really, the culprits of that have changed in our body as we've aged. One is our liver. And definitely as we move through menopause, the estrogen really changes the way that it assists our liver in understanding that sugar processing. And then 2 is at our muscle. So our muscles consume 80% of the glucose that's in our blood, but they're always the last to get it. And they're very sensitive to another hormone called insulin, which is allowing that blood sugar to move from the blood into the muscle. So as we age and we sort of lose that tolerance for that mac and cheese or some of those other high sugary substances, it's really due to changes both at the liver and the muscle. And go ahead.
Also with loss of muscle mass, right? So something that's very common in women is that if you're not maintaining your muscle or building your muscle with strength training, then you're going to lose muscle. And especially with the loss of estrogen, the loss of testosterone, as your muscle mass drops and your insulin resistance grows, then blood sugars raise, and slowly over time, then now the average blood sugar is higher.
Yeah. And, this is why we sort of harp so much about, the importance of knowing your phase of ovarian function and knowing if you are or not in menopause, because menopause really is this like almost quadruple whammy of affecting your body and how it responds to blood sugars. It's changing your liver. It's your decreasing muscle mass. It's changing your brain and how you're able to then make a decision about a cookie. That cookie looked a little bit, it's easier to turn down 5 years ago than it was now. And all those combination of things together can really change the way that our body's processing food.
And I was fascinated years ago when I saw the study that you can even take a healthy 25-year-old male full of muscle, and you don't let him sleep for 4 days. His insulin resistance goes up in those 4 days. And if you put eggs and bacon or donuts, he's going to choose the donuts. That's a he. That's not even a menopausal woman who has low muscle mass and is tired and stressed.
Yeah.
So you don't let her sleep because of night sweats. And now she's craving sugary stuff and her blood sugar is high. So it just becomes this terrible vicious cycle.
Yeah. And if we can talk a little bit more about insulin resistance, I think that that can be important. We have a good picture that shows the differences between sort of healthy tissue at the muscle and others. So on the left is sort of how this whole process is supposed to work. So, you're taking carbohydrates in or glucose in, that gets secreted into our blood. We have an appropriate response from our pancreas, and it secretes insulin. The insulin locks onto that insulin receptor, which is in the yellow, and that glucose moves into the cell, most likely a muscle cell. All right, great, fine and dandy. We think a lot initially in medicine, we thought a lot about type 1 diabetes, which is basically where our pancreas doesn't make any insulin at all. And that results in the glucose not being able to move into the cell and staying high in the blood. And that causes what we call type 1 diabetes. But really, what's plaguing sort of our society in 2024 is what we would call type 2 diabetes. And that means even though our body has enough insulin that's there, there's an issue with that insulin receptor. So the insulin hormone is there, the glucose is there, but there's a problem at the receptor. And what ends up happening is the glucose also stays in the blood, but our pancreas responds by secreting more and more insulin that actually then down regulates the insulin receptor. And it again just kind of creates this whole vicious cycle that we tend to see again and again.
That you don't get macaroni and cheese anymore.
So you do not get macaroni and cheese. Well, at least not in the same volume that you had before.
Love it. Or maybe with a chickpea or a brown rice pasta.
Yeah, right.
not a white flour pasta.
Yeah.
So, we've learned a lot.
Yeah. Going back to the sex deck, I think, we're talking a little bit about menopause as being a reason why women may not be as interested in sex. And kind of the overlap there between blood sugars and menopause is what you already alluded to, right? Blood sugars can also change the way our brain responds to temperature changes and can worsen hot flashes and night sweats.
Yeah, it's been really interesting. Just recently, we had a patient who was taking estrogen, well treated for menopause, but she was still waking up with a night sweat at about 2 a.m. And we'll get to this in a little bit, but I asked her to wear a continuous glucose monitor. And sure enough, my theory was correct. Her blood sugar was tanking because she would have a glass of wine later or a little nightcap before bed. She might have a little snack. Sometimes she'd grab a treat, but so her blood sugar would spike and then it would crash. And when it would crash at about 2 a.m., that's when she would wake up with a night sweat. So as she changed her diet, then she didn't wake up anymore.
Yeah. And, how do you see night sweats play out with decreasing sexual function?
Well, first of all, fatigue. So like you were just saying, I mean, fatigue is a huge deal. And so, I mean, for a lot of women, I know I'm generalizing here, but sexual health, being intimate is something one does when one is rested and happy and stress-free. If you're worried about your kids, you're worried about your aging parents, you're tired from work, it's like, I just want to go to bed, right? So especially then if you're up having night sweats, and now because of all this, you're gaining weight, it's affecting another card in the sex deck, poor self-image, and just feeling like tired, overweight, and it doesn't bode well.
Yeah. And it's interesting that you bring up weight. I mean, obviously I love talking about weight. That's like one of my top things that I love talking about. But what is that connection between blood sugar and weight? There's been a lot of back and forth, and even in the obesity medicine world, we talk a lot about the chicken and the egg situation, right? Do you have extra weight and that's what causes issues with your blood sugar? Or do you have issues with your blood sugar that then cause extra weight? And we can kind of see it snowball a bit. And sometimes it's hard to find the exact cause because every reason why every woman gains weight can be a little bit different depending on what's happening. But a lot of the times we do see this connection with high sugars, that increase of insulin. Insulin really prevents our fat cells from basically shrinking. So even though we may not be consuming a tremendous amount of calories, if it's high sugary calories, we tend to lock our fat cells in place. And it's really a struggle then to lose weight with just high sugar, low calorie diets alone. And one of the worst case scenarios that we see is a woman who's doing a lot of cardiovascular aerobics, right? So they're asking their body to burn a bunch of calories. and then they replace that with a high sugary, low calorie meal. And a lot of the times that the liver and the muscles just don't know how to respond because the insulin levels kind of keep going up, and it's just not allowing that energy flow to move appropriately.
So it's on one hand, it sounds complicated, but it's not. Like, it's just this big vicious cycle that happens. And, it's like, when are we going to stop and get off the train?
Right. And then unfortunately what ends up happening is, your body's trying to sort of continue to store and figure out what to do, but our fat cells, our subcutaneous fat cells, which is that pinch the inch fat that we have on the outside of our abdominal cavity or at our thighs or some other places in our body, sort of reaches max capacity. And then we end up storing weight as what we would call visceral fat. And that's fat in and around our organs. And that's really not the fat that we want. That's really correlated with having all those chronic disease processes that we're all trying to avoid: cardiovascular disease, stroke, hypertension, dementia. So when you get in this place where your blood sugars are getting higher, that's where we tend to see some of this weight gain. And then, of course, women just don't feel kind of as good about themselves. Not that they shouldn't, because you are allowed sexual health at any size and age. But, it does sort of end up being an issue that we talk a lot about with our patients.
Right. And so again, women just want to know, like, what can I do to feel better? And I think number one, it's about knowing the problem. Missy, do you want to put that picture up around blood sugar in different organs, the eye, the liver, where she looks sad? So, again, we just think about all these different areas that are affected by high blood sugar. And so, again, these are the downstream effects. But a lot of times we're seeing, again, with high blood sugars, people feeling tired, again, gaining this belly fat that they have a difficult time losing, damage to these end organs. And we want to catch women way before this kind of stuff happens. So,
yeah. Unfortunately, sort of our American medical system is sort of designed to catch it at these end organ, right? Like, we sort of will throw the kitchen sink at anyone having a heart attack, not that we shouldn't, but yet, like, when we want to sort of look into maybe if someone's having a little bit of sugar problems, it tends to be kind of a harder sell. But being a proactive patient, there are definitely ways that we can look to see if you're having blood sugar problems way before you develop some of these end organ issues.
Exactly. And, again, as a gynecologist, not practicing primary care or internal medicine, but, I was just really amazed to see people that we didn't expect. Like, I was taught that women who are overweight likely might have high sugar issues or strong family history. But now that, when you start looking, sometimes you find it in places you don't, expect. I remember, having a patient who was thin, healthy, no family history. We check an A1C, a blood sugar average over 3 months on every patient for new labs. And she's thin and her blood sugar is a 6.0. And we can talk about those ranges, but she and I were both floored. And again, Celia, I think it's amazing how many people are walking around with high blood sugars and don't even know it.
No, so about 50% of the population actually test positive for either having pre-diabetes or type 2 diabetes. And we'll explain a little bit what that means. But that's just the people who have been tested, right? We see a lot of patients in our office that honestly had no idea sort of where they're at. So what people don't actually know, and it can be confusing because every sort of, maybe doctor, knowledge bank, insurance company, hospital system will have different ideas as to what a diagnosis is for calling that patient, a type 2 diabetic. But honestly, the definition's pretty broad. And so what we're looking for is any reason why your sugars are not responding appropriately. So one, that could be a fasting blood sugar. So that means you've, gone about 8 to 10 hours without eating anything. So if your fasting blood sugar is above 100 to 125, that's considered pre-diabetes, or anything of fasting above 126 is considered to fit the diagnosis of type 2 diabetes. Another way of doing this, which we do a lot during pregnancy, is we give patients a load of glucose, and then we hope over an hour that their body should be able to sort and distribute that glucose load, and that sugar should not remain in the blood after an hour after they've consumed that sugar. So if you look on the far right, we call that a glucose tolerance test. So normal should be anything below 140. pre-diabetes is 140 to 199, and above 200 is considered type 2 diabetes. And we actually use this diagnosis a lot because we tend to find patients will have random blood sugars above 200 all the time on their CGMs. And we'll talk a little bit more of, what our CGM is, but that's just looking at a random blood sugar. And we find that all the time. The most common way that I would say hospital systems and doctors' offices these days are looking for type 2 diabetes is looking at something called a hemoglobin A1C. That is looking at the sugar around our hemoglobin cells, which are our red blood cells that have a certain age life. And in general, they should have a certain range for how much sugar is around those red blood cells. And we would say that's anything below 5.7. Anything above, 5.7 to 6.4 is pre-diabetes, and anything above 6.5 meets the diagnosis for having type 2 diabetes.
And what's kind of cool is, the red blood cells last about 3 months. And so this looks at an average over 3 months. And, how many patients have a fasting blood sugar maybe of like 92, 94, which is still in the normal range, but yet then their A1C might be 5.8, 5.9. I've been really amazed by that.
Yeah. And there's so many, as we've gotten sort of more involved, what we will call the continuous glucometers, and we'll talk a lot, we're going to really dive into those in just a second. But, we've really found different patterns where people can have, an AM sugar, because that's usually when they get those first labs in the morning that are great. And for whatever reason, their body sort of is able to process those sugars all night. But the second that they eat anything, right, their body really can't handle any sort of, glucose load or any sort of carbohydrate load.
So,
all right. So that's pretty exciting. So, we've been, just to kind of move into like what we would call our continuous glucometers. So anyone who is curious about where their blood sugar is at, or, wants to have more knowledge, we'd always encourage them to wear what we call a continuous glucometer. So what a continuous glucometer is it is a filament and sensor that's in sort of your subcutaneous tissue, or right kind of in your fatty area under your arm, and it's measuring your glucose all the time. So you could check your blood sugar, 300-400 times a day if you wanted to. You don't have to, because it actually tracks it for you. And then you download an app on your phone, and is used as the meter.
So this is telling me it's time to put a new sensor on. So how about we do this right now? So I've got the app downloaded on my phone. And, I think this has just been so cool for people to see, because it allows you to learn about what your body tolerates. I would say that the CGM has humbled me as a physician. Before, I might have said, hey, I've learned about low glycemic index. I used to love some books about that now are not so applicable. But just to really learn, like, what's a low glycemic index food? And I used to think a banana would be fine, but now I've learned that bananas make my sugar go crazy. And I can't tell you the last time I had my favorite food on this planet. So it's really been fascinating, which has helped me feel better, have more energy, less fatigue, but also understand why I was gaining weight when that didn't make sense.
I think that it's, helpful, because I think anyone can be a candidate for a CGM, even for 2 weeks. I don't think every patient needs to wear a CGM all the time, but it definitely can be helpful to wear, just to learn about kind of your body's responses to food. And it's always surprising how some people can respond to bananas with high sugars, and some people don't. And so it's just everyone's body is just sort of a little bit different. So great.
Well, real quick, what I've learned from you too, it has to do with the gut biome, how much fiber you're having. And, it's been fascinating because we've learned 3 main things, right? Like a food, it really matters how much fiber's in it. So, an apple has less than a pear. I can eat a pear. I can't eat an apple. It's about having more protein first. So if we have more protein, then, right, you can explain it better, but it slows the absorption of that sugar into the gut.
Yeah. I mean, I think if you think of, what happens if you were to eat food, first your mouth sort of chews it into mush, then it goes into your stomach acid turns all that into a liquid, and then it moves into your small intestine. The first round that, all your food gets is your microbiome. So depending on which species are there and how healthy that is, really then depends on what the sugar that they're consuming, and then what's able to be absorbed from your small intestines and move into your what we call your portal system or head onto your liver. It's truly that sugar load that we care the most about. So whatever we can do to manipulate what's happening in our small intestines can be really helpful about dictating what's happening on the back end and what our liver is saying.
Exactly. And just a real quick shout out to Jessica. Hey, Jessica, long time no see. I hope all is well with you and your family.
Oh, that's
so
cute.
I'm glad you chimed in. Thank you.
Okay,
so long time. Good memories.
If someone were to get a CGM, what they're going to get is a box such as this. So FYI, we have no relation to Abbott other than we just like their products, FYI. So you'll get a box like this. And what you're going to do is you're going to want to open up the box. And then in the inside of your box, you're going to have all in one now, which they keep advancing, is an applicator. And inside this applicator is a sensor, an adhesive, a filament, which is going to go into your skin, and the needle. And what's going to happen is once we twist this off, what we'll be doing is, oh my gosh, Jessica, how exciting.
Good job, Jessica.
Weight loss.
So proud of you.
That's awesome.
Congratulations.
Yeah. So again, what we're going to have here is an applicator. And once we twist this off, what's going to happen is I'm going to activate the applicator. And what's going to go into my skin is this micro needle that's going to place the filament into my subcutaneous tissue or right into kind of my arm fat and then pull back. And what will be left will be the microfilament, the adhesive, and the sensor. The needle will be gone. A lot of people will ask us that question, like, doesn't it hurt? And like, what can I do with it? The answer is no. The needle is now gone and it's removed from your skin. And, there's just the sensor there. And for the most part, it doesn't hurt, right? I mean,
I'm a wuss. It's a little bit for 2 seconds. But, and the other key I think is really important. If you put it over here on the side, it's easy to knock off. We'll have people that will call us and say, I hit it on the door jamb or I hit it in the shower. So it's really important to put it underneath, not only the fatty tissue, but so you don't knock it off. And of course, you don't want to put it here because then it will bug you. So it's just really important. And I just think about put it just right straight up. You ready?
Yep. So real quick, where you don't want to put it is you don't want to put it in your muscle because that's not particularly helpful because that's not how the formula is designed. It's really, again, meant to be kind of in that fatty part of your arm tissue. All right. Should we do it?
Let's do it.
Open up my applicator. As you can see, ready? One, 2, 3. That's it.
There we go.
Super easy, no pain, and now it's stuck on there.
Right.
And that's
it didn't hurt. I think it just matters kind of luck of the draw too, if you get a little nerve or not, but
that's true.
And occasionally, last time I must have hit a little vessel because it just had a little bit of blood. So don't worry if that happens.
I will say an interesting thing that I've found with patients is if they're sick, it actually tends to have more bleeding. I think you're vascularly expanded. Once you have it sort of activated and ready to go, then you open up the app on your phone and then you scan the sensor and it gives you a little bit of a shake. And then it says that it's good to go. And then it takes about 60 minutes to calibrate out, and then it's good to go, and it will start feeding you readings all the time.
Right. And so what I'd like to just show, I can show the daily graph. So I just took it off today, the other one. But, I can look at the graph and just see when I ate something that was a little higher in simple carbs. So that was 6 a.m. yesterday. I don't know what I had, but it's really interesting because there's a place that you can put in what you ate, but I've got my range set from 70 to 110. So my goal is to keep my blood sugar right around 100. Again, Celia, correct me at any time. And, when I first put this on, it's just so I'll see it where it just is going crazy. And I just over the time of wearing it, I'm able to hone in what I'm eating to keep it really stable. So it's really fun to see it over time.
Yeah. And so, one thing we get a lot of questions. So let's just I'm going to run through some of those
Please.
That we hear a lot. One big question is what should my range be? And I think even that is sort of up for debate because I think that, if you get one random sugar above that goes up to 140, is definitely not the end of the world, right? And we don't want people sort of panicking that their sugar goes above, 110. But it is something to learn from, because I would guess that over time, continuous meals of it going above 140, 150, 160, can lead to the development of insulin resistance. So overall, the goal is to sort of keep it closer to that range.
Well, just that's when you're going to start to see your average go up, right? So,
Correct.
if your highs are frequently higher than 120 in the 140s, 150s ones, then you're going to see that A1C come up, and now that diagnosis of prediabetes.
Yeah. Other things that people see is, sometimes your blood sugar can go up and then it can fall, and it feels very panicky, right? And your alarm will go off in your phone, because although your body can tolerate highs for decades, right, it tolerates lows poorly for minutes. And so our body has we don't like our blood sugar to low. People can die from having what we call hypoglycemia or low blood sugar, but your body's designed to handle a low blood sugar. This has probably been happening, right? And your liver is a backup supply that kicks on to sort of help make sure that your blood sugar doesn't go too low, unless you're taking a medicine that would prevent that. So that medicine in particular is insulin. So if you're a patient who either has type 1 diabetes or has what we call insulin dependent type 2 diabetes, your low is real, and that's something you have to respond to. But if you are not taking a blood sugar lowering medication and your blood sugar is going low, for the most part, your liver will take care of it.
And here's, if I may, what I find really interesting is that when women's blood sugar drops low, your body has an adrenaline response. And that adrenaline response triggers your brain to, danger, danger, tells the liver to release the sugar. That's also what causes a hot flash. There's a part of the brain, it's the candy neurons, and they release substance P and neurokinin Y, and not neurokinin Y, neurokinin B. And what it does is it makes your blood vessels dilate at the skin to cool off. It's a stress response. And that's how we see the relationship of the low blood sugar and the night sweat. It to me, it's just fascinating.
Yeah. So, we don't want people to panic if they're having low sugars. And obviously, if it's happening very frequently, that should be a conversation with your provider to talk about kind of what would be the next best, game plan in terms of eating and sort of doing some other things. We also see that blood sugars can go up with exercise. This is not a concern or a worry, right? This is, kind of, again, sort of a stress response that happens with exercise. And for as far as we can tell, that's not something that needs to be worried about or be concerned.
And to dive just a little deeper, I think it's just been fascinating in terms of like a zone 2 exercise where it's just a really low level aerobic. I'll see my blood sugar stay stable, but if I'm doing a HIIT workout, my blood sugar goes really high, right? There's that stress response with a high heart rate. And it's just fascinating when we get into how we're able to lose weight or not. So that's for another day. But again, as you start to notice these patterns, it can be really informative.
Yeah. And I think sort of, again, as we've already alluded to, the best way to sort of use this is to sort of tailor some of your food choices. So, we tend to get lunch at a certain place at our office a lot. And as time has gone on, I've sort of refined my order so that I know that it keeps my blood sugar toky, right? And, it's not as though I feel deprived, right? It's not drastically changing, and I'm still enjoying it with everybody. And it's still an office favorite.
But no white rice.
No, actually, it's the dressing. The dressing has always gotten me.
For me, it's the white rice.
No, so for me, it's always the dressing.
Yeah,
but
I can get the dressing.
Again, everyone's a little bit different, and that's just changes how you kind of can make some different food choices.
Yeah, exactly. And and then the other thing I've noticed is after lunch, sometimes I would get sleepy, and other patients have shared this as well. And I would think, oh, I'm sleepy, I need to eat more. No, turns out it's because my blood sugar is too high. And so when it's too high, I get sleepy. And so I'll just go do the stairs a couple times or some squats and lunges. Blood sugar comes down and I feel better again. So I've just found my favorite blood sugar is about 95.
So again, this tends to be a great tool that, if anyone is interested, we're kind of happy to write the script. We wish insurance companies covered this for anyone who wants it. Sometimes, we can get it covered or at least get a sample or two off for our patients. But we'll try our best to kind of get you a CGM if you'd like one.
What I think is really fascinating, I mean, all the respect, because this is a new way that we're using these tools. But I had a patient the other day who's a a type 2 diabetic on metformin, and her doctor said she didn't qualify for a CGM. So, I don't know where that comes from. Again, I don't mean disrespect, but I just think, again, this has to come from all of us wanting more information. And so if this is something you're interested in, I would just say be perhaps a bit pushy and really, like, you deserve to know, and you deserve to have a script written for a CGM. And you're able, if you have a script out there and your insurance doesn't cover it, you can pay cash for it. And it's, I can't remember, but it's under $100. So even if it's once a quarter, every 3 to 4 months that you wear one, just to sort of refine things in, I think it's really helpful.
Yeah. And thanks, Lori. Lori said she's interested. And so that's very exciting. We'll definitely talk about that at your next visit. All right. Should we move on to our 5 tips?
I think that'd be great.
Tips? Okay.
So, picture of self. You want me to take this one?
Yes, please.
Yeah. I just love this. So, picture of self, we think about that as, what is your goal? How do you want to picture yourself at a specific time in your life, a specific day, a vacation, a birthday? A patient the other day, she's like, I want to have sex until I'm 80. Okay. So,
Nice.
To do that, part of that is being really healthy. And so, she really thought, I don't want to have to fake it. I want to be able to have an orgasm. I want to. So again, I would ask all of you to think about, what do you want for your sex life? And, a lot of people think, oh, after 50 or after 60, I don't want that to be a part of my life, or I don't think it can be. So this is not something that you have to settle for lack of. It's to understand, number one, what do you want? And then we can help work with you on how to achieve that.
Yeah. And I think what's so important to remember is not every woman has a super strong sex drive, and that's okay, right? Everyone's sex drive is different. But if it was something that now it bothers you, right? That it's something
distress.
If you're distressed, right? That, you used to have a good sex drive. Now it's different. Now there's, changes, and that bugs you, then that's worth a conversation with a provider.
Well, and the other thing is, what is sex, right? It's intimacy and pleasure. It doesn't have to mean penetration. It doesn't have to mean mutual orgasm. It doesn't have to mean all of that. It just is pleasure and intimacy. And that can change also with time. It can be hugging and cuddling and, but if it's intimate and there's pleasure, that's sex. That's sex, yes.
Yeah. All right, great. Number 2. Take a deep dive into your blood sugars. I think we've talked a lot about this. There's a lot of different ways to look at your blood sugar. And even if you're just a person who wanted to pay cash for a CGM just to see kind of where your blood sugars are going, I think it can be worth it. At the very least, if your fasting sugar, which is usually drawn on all basic labs, is starting to sort of creep up over time, it may be worth a conversation to get a more advanced labs checked, like a hemoglobin A1C.
Yeah. And again, I would just even recommend be bossy and get an A1C, because you can have a normal fasting blood sugar. And, our third takeaway tip is, take advantage of this new technology. It's amazing. And, for so many years, it's only been something that endocrinologists or diabetes specialists use with their patients with a type 1 diabetic. And this has been life-changing for people with type 1. But now that this technology is easy, it's safe, why not for all of us to learn more?
And I always make this joke with my patients, as patients' primary care doctor, the phrase I don't want to hear is, out of nowhere, they had a heart attack, right? We have technology now that can look into risk factors a lot more clearly. And not every person has to do every one of those tests, but if you want it, it is there for you, right? If you want to know some of these answers and really, truly understand your risk, there are a lot of great tests that are out there. They're maybe not for every person, but it's definitely worth a conversation.
Exactly. And the same thing, I just got diabetes. Well, no, you've had this developing over the last 10 years. So again, I think that's what we love doing, right? We want to be part of the people who help prevent people from having these conditions in the first place.
All right. Number 4, there's a connection between your blood sugars, your biologic health, and your sexual health.
Yes. Who would have thought? When you first had the idea for this talk, Celia, I was like, okay, wait, no, actually they really are connected. So I just love, and I think you and I are almost the example for this, right? So OBGYN, menopause specialist, and sexual health specialist with internal medicine doctor, like it's bringing us together. And I think nationwide, we're one of the first,
One
groups
of
that
the
have
first,
had,
if not the first.
if
Yeah.
not the first, yes.
If not the first, to sort of understand how deeply these are connected and how they're just so helpful to play off one another because the overlap is just so strong.
It's so strong.
Yeah. All
Number
right.
5.
You are worth it. Your desire and function, when your desire and function are low, no, it is not your fault. There are real health and body factors that play a part, and you deserve to know.
And that's what I think the sex deck helps so much, is that it's not your fault, it's not your partner's fault. It's stuff, it's conditions, it's reasons, it's things that can be addressed if you don't want them to have power to affect your sex life anymore. So it's so important, and you are worth it.
All right. So if you are not in Michigan or Ohio or California or Florida or Wisconsin or Alabama, I don't know, all these different states that we're in, and you want to see your doctor, which is of course something you should do, here are some questions that you should ask your primary care doctor if you can't come see us. What is my phase of ovarian function?
You gotta know this.
Yes, you gotta know this. I hope we've sort of gotten all of our patients, all women, to understand where you're at in terms of your phase of ovarian function can play out in many different ways in your life, between your metabolic health, which is your body's way of handling energy, which can lead to changes in your sugars, your blood pressure, your weight, your cholesterol levels, and changes in your sexual health, and changes in your sleep, and possible menopause symptoms that you didn't even know about, right? Energy.
This list goes on.
It keeps going on. So you need to know your phase of ovarian function. If you ever had any questions, you can always check out our website at truewomenshealth.com and review our symptom circle, because sometimes you'll be surprised. I was surprised, right, when I first sort of gotten involved with menopause, of some of the symptoms that can pop up and kind of their overlap of, or how important they are to know where your phase of ovarian function is and understanding the next best treatment options.
Exactly. So super helpful. And yes. Oh, and has your blood sugar. So I would ask you again, this is, primary care, internal medicine, but has my blood sugar been evaluated? So again, super important for you to ask your doctor, like, has my blood sugar been evaluated? What is my A1C? What is my fasting blood sugar? And, how can I figure this out and then mitigate any changes and make it as good as possible?
Yeah. And I think we always try to provide respect to all the other doctors, but honestly, in today's age, I don't think there's any reason why you shouldn't draw a hemoglobin A1C in a patient. And if you have a doctor that's unwilling to order that lab for you, it may be worth a conversation about, finding someone who has a little bit more of knowledge bank in blood sugars and understanding about metabolic health.
Exactly.
Yeah. Number 3, am I a candidate for a medication to help with my sexual health?
So on the sex deck, on the back of each card is, let me find one here. So difficulty achieving orgasm. So for example, the causes of this are lack of knowledge, menopause, performance anxiety, pain, medical conditions such as diabetes, medication side effect, or inadequate foreplay or arousal. But what are the options? And one of the options is medication. So for example, once you're educated, you've talked about anxiety, you've used Sensate Focus, you've taught yourself more about your anatomy with a vibrator or a sex toy, you've treated the cause of pain, but there are medications, such as testosterone. So testosterone, women, we make as much testosterone as a guy, we just express it differently. And in menopause, testosterone levels fall pretty quick. And we know that testosterone has been shown in randomized controlled trials to help with sexual desire, as well as arousal and ability to have an orgasm. And there are also 2 other FDA-approved drugs that help desire, including Addyi, which is a daily use drug that's a serotonin modulator taken at night or in the morning, and it's helpful to help overall desire. About 66% of people respond by the end of 3 months. So that's an option. And the other option is a drug called Vyleesi. We have nicknamed it the horny shot, but it's actually a shot that one woman gives herself, and it can actually help increase sexual desire. Warning, it lasts about 12 hours. So some people say they don't have time for all of that, but yet the
crack open a coffee and you better be ready.
Exactly. So there are FDA approved medications for low sexual desire, and we know there's more medications in the pipeline coming down. I've had several women that we've used the little purple pill or sildenafil for sexual desire and arousal orgasm deficiency, and it's worked very well. So again, there's lots of options, and you might be a candidate for medication to help with your sexual health.
Boy, Dr. Bitner, if you come to our clinic, you're going to maybe you'll get a weight loss shot. Maybe we'll get the horny shot. It's like, we're like shots.
Well, it's funny because researchers thought women aren't going to want to give themselves a shot for this. Oh, they do. So it's a very effective, and we're very grateful for researchers to discover this.
This is sort of a completely off topic, but I would say one of the biggest misconceptions in sexual health is that women don't have a good sex drive, which I would argue is not true.
Well, why did 50 Shades of Grey sell 20 billion copies? I mean, hello, it's just that sometimes the relationship is becomes so distant because it's such a scary topic. So get the sex deck, figure out something and a good friend of mine too, I just want to shout out for Lindsay Harper, who invented Rosie. Rosie is a company that has that's a wonderful resource for women to explore their sexual health and to understand and think about it in a different way that can really offer tips and tools to talk about sex and to explore your sexual desire. Mm-hmm. So check out rosie.com.
Awesome. All right. Number 4 question. What resources do you have to help get my blood sugar under better control? So, when we think about all the ways that our blood sugar is being activated, it's so multifactorial. It depends on our sleep. It depends on our exercise patterns. It depends on the different foods that we're eating. It depends on our ability to make good food choices, right? So, understanding and exploring all those different areas in a completely non-judgmental way can be really helpful, right? You could be sleeping, you could be exercising, you could know what healthy eating is. But if you're struggling with high craving and binges, that means you need to see a food therapist, right? And understanding the role of what that looks like. Or maybe you're someone who has truly no idea what healthy eating is. That would be a time to see a nutritionist or a dietitian, and they can kind of help you come up with a better understanding of what a good meal plan would look like. There's a lot of different resources within different communities, and, lean on your primary care doctor to maybe help guide you in one direction or another.
Exactly. And knowledge is power. And so many women come in asking for accountability. And so, these CGMs can really help with accountability. I'm not going to have a banana because I know my sugar's going to go crazy. So again, wherever you are, make sure you ask about these resources. Hey, Melissa, thank you.
What's really interesting about a CGM is not only does it provide knowledge. So I'm going to backtrack and say, we make a food choice for 3 reasons. 1 is knowledge. What should not be eating? 2 is logistics, right? I know what to eat, but how do I get it to my house? How do I cook it? How do I afford it? How do I make it tasty? And then last is ability, right? Maybe I have salmon and broccoli in front of me, but everyone in my family is having pizza, right? And I smell pizza and I hear the pizza box and I feel like the grease on my face, I'm going to eat pizza, right? Even though I have a better maybe food choice in front of me. So if we're thinking about the ability piece, so, 1, CGMs help with education, right? What is going to cause my blood sugar to go up and down? Great. We're learning and understanding. But that second piece is ability. So why we choose to eat a cookie is because your brain thinks you're going to feel better. That's why we all do it, right? Because we're like, I kind of feel bad and that cookie looks amazing and now I'm going to feel better. But when you see that huge spike in your blood sugar go up, your brain kind of makes this weird pause. And it's like, well, maybe that cookie wasn't as good as I thought. And maybe it didn't quite taste as good as I thought. So the next time you come to a cookie, your brain's like, all right, here we go. I'm going to eat this cookies. I'm going to feel better. And then it's like, wait a minute. I kind of didn't feel bad. That kind of was weird when my blood sugar went up. Maybe I'm okay. I'm going to turn this cookie down now. And it's this weird back way of kind of changing some of our mindset around eating. Of course, we still should be open to, if you want to have a dessert and, that's what sort of feels good and right, that's what you should do. But there's a lot of times when that maybe isn't the best choice. I tell my patients, you control food, food doesn't control you, right? If it's your birthday, or we talked about weddings, if it's your wedding, you're going to have a piece of cake, right? Because it's your wedding day and that's you controlling food. But that leftover donut from yesterday's meeting that's there in the break room and it's calling you, that's food controlling you. You can turn that down. And that's what we're trying to target.
Exactly. I love that. And again, it helps accountability.
Yeah. All right.
I wanted to point this out, that the company has a great website, and you can download and get lots of information. So I'm just really pleased that they have this, again, for people to make this more accessible and to know what to do with the numbers.
Yeah. All right. What resources, number 5, what resources do you have to help improve my sex life? So your sex life is a part of your medical life, right? Your medical history.
Mm-hmm.
And if you don't have appropriate resources, you can always check out our website to maybe purchase a sex deck if that's something that has intrigued you and that'd be interesting. And then of course there's a couple other resources kind of around.
Yeah. So again, check out our website, truewomenshealth.com. Also, I'm proud to, Missy, I forgot to tell you about this, but Prosayla, Prosayla. I'm a part of a group called Ishwish. I'm missing their national meeting right now. I should be there with my crew. But prosayla.com is a website that we've developed to help educate patients around reasons for low sexual desire or questions they might have about sexual desire. Or it's just an awesome website. So I was honored to write the article about lichen sclerosis that's on the website, but these are articles that are vetted by medical professionals as well as patient advocates. And so I'm just very proud of being part of that group to help, again, educate people around sexual health. So there's a lot out there at this website and by Ishwish, the ISSWSH. You can help find a provider in your area that is a member of Ishwish. And so you'll know that they've received education. There's no certification, but yet they've received education and they're very aware of sexual health and able to talk about it in a healthy way.
Awesome. Well, another great conversation about how our worlds collide and how we keep trying to get women as healthy as they possibly want to be.
Awesome. So thanks everyone for joining. If you had friends who wanted to watch this and they were busy, please share this. We want to get the word out that there is help, and our goal at True is to reach as many women as possible or many people as possible. So please share this and or tell people to log in and we're here. Send us a question, come see us, whatever works. We wish you well.
All right. Good night.
Good night.